Hello and welcome to our live chat on women's health and the new preventive services available to women under the healthcare reform law. I'm Annic Jobin from WebMD, and I'm happy to be joined by Secretary of Health and Human Services, Kathleen Sebelius. Secretary Sebelius, thank you for joining us.
Oh, glad to be with you, Annic.
So our goal today is to answer as many of your questions as possible about the new services that will be covered by health plans starting on or after August 1st, effective when your plan renews or if you get a new plan. Now, we reach a lot of women at WebMD. Of the 107 million people that we serve each month, the majority are women. And many of you are the family managers and the caregivers for children, spouses, aging parents, which leaves very little time for your own health. So today, it's important to talk about your health and the services available to you. So before we discuss the new preventive care that will be available, let's take a quick moment to remind everyone about some of the key services for women that are already covered under the Affordable Care Act with no extra cost to you. And by no extra cost, I mean no copays, coinsurance, or deductible for those services. Now, Secretary Sebelius, I bring this up because we got a lot of questions about what about my mammograms and what about screenings for cervical cancer? Those services are already covered under the healthcare reform law, correct?
That's right, Annic. Part of the goal of the new health law is to keep people healthy in the first place and not wait until people need to go to the hospital or have an acute medical condition. So getting preventive care is really a shift, and a shift without copays, deductibles, coinsurance, to put down financial barriers that might be in the way of someone getting the prevention they need. So starting as far back as September of 2010, 6 months after the new law went into effect, a whole host of prevention services for men and women and children went into effect without copays and deductibles. Recommended cancer screenings, flu shots, children's immunizations, again, available and updated by the U.S. Preventive Services Task Force, a group of medical providers who each and every year look at the evidence and make new recommendations based on the newest science. When their recommendation is a or a B recommendation, those automatically get added to the list of preventive services available to men and women who then get added to your insurance policy without copays and without deductibles. The second set of prevention services came into effect in January of 2011 for Medicare beneficiaries. The majority of Medicare beneficiaries are women over 65. As we get older, women become a larger and larger group of Medicare beneficiaries because we often outlive our spouses and colleagues. But Medicare now has a whole range of prevention services, cancer screenings, a well woman visit, other issues that were added to the Medicare policies, again, without copays and without coinsurance, a big step forward. So this is actually kind of the third step of the process.
Great. So now that we've covered the health services that are already in place, let's talk about the 8 new prevention services, and we'll start with the well woman visits. We received a question from a woman named Bev who wanted to know what exactly is included in the well woman visit. For example, she asked, does it include a physical exam?
Sure. It's really a checkup. It means that you're going to see your doctor not because you're sick or have an episode of some kind or need a treatment, but because you're getting a checkup. And typically that would not be covered without a copay or coinsurance. We think it actually makes good sense for people to get checked on a regular basis. So it absolutely includes a physical exam. And it's an opportunity for a woman to have a conversation with a healthcare provider when she isn't in some kind of serious situation about how to stay healthier. You know, maybe she wants to look at weight issues, or maybe she's having trouble exercising because of some problems. I mean, discuss a situation that may be appropriate to her. And women, as you said earlier, Annic, often don't take enough time for ourselves. We're taking care of our kids, we're looking out for our parents, we're urging our spouse to go get checked out, but we come last. So this is really an opportunity to say, this is a good idea. Once a year, go in and see your own physician and have a conversation about your health.
Great. Now, contraception and contraceptive counseling, a popular topic.
Yes.
I should add here that in addition to getting questions from WebMD, we reached out to Medscape, our network for healthcare professionals, to find out from them what are the questions that they hear the most often from their female patients. And one of the questions that they heard over and over again, whether they are nurses or doctors or pharmacists, had to do with inadequate coverage for birth control. Even among women who have coverage. And one OBGYN in Florida told us that his patients are eager to use long-term birth control methods like IUDs, birth control implants, but the patients complain it's not covered under their health plans. So the question would be, what exactly will be covered now when it comes to contraception?
Well, as we like to say, today is a new day for women's health. All of the FDA-approved contraceptive methods, including long-term IUDs, implantation methods, will be covered under this plan. No copays, no deductible. I mean, what we know, Annic, is that contraception is the most frequently taken prescription drug for women 14 to 44. Women take it not only to make family planning decisions, but also it's used for a variety of other medical conditions. And as you say, lots of times people would rather look at a longer lasting method than a once-a-day pill methodology, and those range of services will be covered. So having a conversation with your healthcare provider, figuring out what's best for you in your situation, your age, your interests in what kind of decision you're trying to make, short-term or long-term, that will now be a covered service. Many plans in the private market didn't cover contraception at all. So women were paying 100% out of pocket, even if they were covered. As you say, the choices were often limited, and often high co-pays attached to it, so that lots of women were in a very difficult situation. Now, this has gotten a lot of attention because there are some employers who have religious objections to offering contraceptive coverage. And there are two pieces of this puzzle. First of all, if you work directly for a church or a church auxiliary, those entities as employers are exempt from this coverage. Secondly, a religious employer who has religious objections, so a Catholic hospital or a Catholic university, we are in the process of developing a method so that the contraception will be provided to those employees. In one additional year, they'll have to wait an additional year, but the employers won't ever purchase or refer people or pay for the contraception. The mandate is really on the insurance company or the third-party administrator. So we want to make sure women have access to that health benefit and make their own decisions about whether or not to use contraception, but at the same time respect the religious objections of an employer. And so figuring out a strategy for what is a relatively small number of women, but an important group of women who also need to make their own choices about their own family planning issues.
And how young or old does a woman have to be to have access to the contraception or the counseling? Is there a minimum age?
Well, there really isn't. It depends on, a family plan coverage. But if a woman is in a situation where a provider is recommending a family planning method, then the insurance policy would cover it.
Okay, great. Well, a related topic that was also popular was screening and counseling for sexually transmitted infections. One WebMD user asked, how often STD screening will be allowed or covered?
Well, my understanding is that the method may change depending on the recommendation of a physician, but at least once a year, the screening would be covered as part of the program. Now, that could vary from person to person if there's a reason for a more frequent screening. But what we know, we just finished a major conference here in Washington around HIV and AIDS. So in addition to STDs being screened for and counseled, this also includes HIV screening. And women are, unfortunately, a growing percentage of the population of new infections. So what we heard over and over again at the conference last week is that often healthcare providers just overlook the fact that some illness presenting itself may actually be related to HIV. And so this is another important issue, not just to have covered, but to kind of remind providers that it's an important screening for women to get.
Right. And I think there's another service that might be good to mention here is the HPV DNA testing for women.
That's right.
Now, I think that's only available for women, or we're adding it to women 30 and older. So my question was, why 30 and older?
Well, because the Preventive Services Task Force is already covering the basic screening, which is related to cervical cancer. So this is really an additional DNA test for a slightly older population to make sure that that testing is complete and that we actually, again, look at the determination of whether or not the woman is more likely to be cervical cancer a victim in the future, and catch it early, begin to treat it early.
Yeah, that's the key, catching early. Okay. Now let's move on to services for women who are pregnant. Plans are now going to cover screening for gestational diabetes. Can you help explain, are there specific tests at different points in the pregnancy, and should all women who are pregnant look to get this screening done?
Well, I think it is a highly recommended screening to do, because gestational diabetes is not only very dangerous for the mother and potentially for the infant, but is often presents itself in women who have no symptoms of diabetic condition prior to a pregnancy. It's really a condition that is brought on by pregnancy. So having, regular consultations with your OBGYN, getting regular prenatal care, which is highly recommended for all pregnant women, but making sure that, again, this issue, which can be really life-threatening, is looked for along the way, is an important piece of this puzzle, and again, will not cost additional money, will not take additional out-of-pocket costs for a family who may be, trying to save every dime to get ready for the baby's arrival. Often, they might think, well, we don't have to do that extra test. This is an important extra test to do.
And we also heard from expecting moms who wanted to know how the breastfeeding services will work. So one woman asked, will my insurance provide a list of lactation consults or other providers that are covered under my insurance? And what about breast pumps? Are those covered? So essentially, how far-reaching is this provision for breastfeeding?
Well, I know that there are lots of lactation counselors, and often connected to a prenatal visit and classes. In fact, my daughter-in-law is pregnant right now, and she just went to a lactation. I'm very excited. It's all about being a grandma, it seems like a good deal to me. But she has just finished lactation classes. Now, that was part of her prenatal care, so I am not exactly sure. I think this may vary from place to place how broadly the counseling will be covered. I know that it does cover counseling, and whether it's directly related to your OBGYN practice or can be a broader group. But I know also that the insurance policies will now pay for breast pumps and counseling services. So some moms, need additional help, and the baby may not take to nursing right away. But what we know Annic, is how valuable it is to not only an emotional bonding experience between mother and child, but long-term health benefits. The baby builds up enormous immunities to all kinds of situations if he or she has breast milk for at least a couple of months. So taking some time, having some consultation, helping a working mom with some supplies has long-term health benefits for that infant, and long-term, I think, bonding benefits for both the mother and the child. So this is, again, people look at that and say, how does that get to be a preventive service? Well, it's preventing a whole lot of childhood illnesses that we know are less frequent in babies who actually start their life with breast milk than start any other way.
Now, domestic violence screening. If we have any women watching today that are suffering from abuse, whether it be physical or mental, where can they go for help, and what type of counseling is available to them?
Well, again, I think this is an issue which often is kind of off the radar screen. I think a lot of women, I used to work with domestic violence victims, and it's an unfortunate equal opportunity. Victims, all races, ages, ethnic backgrounds, income levels are at one point or another, unfortunately, victims of domestic violence. And often people feel ashamed or feel that they have done something to cause the violence to occur. So just as a practical matter, reaching out to someone that you feel safe with, a friend, a neighbor, certainly if you have a doctor, reaching out to a healthcare provider. I think in every community in this country there are shelters, there are safe houses that women and their children can go to and be safe and secure. And many, many states now have mandatory arrest programs, so there's a lot more protection around a domestic violence victim. But this is the situation in the insurance market. Right now, prior to the Affordable Care Act being law, it was legal for an insurance company to deny health coverage to a domestic violence victim because she was a domestic violence victim, because that's considered a pre-existing health condition. That will no longer be legal by 2014. That will become a thing of the past. This is also a way to make sure when you visit a healthcare provider that you can get some additional help and support, because a domestic violence victim may also need mental health services, which are available as part of insurance plans, may need some additional physical attention for bruises or issues which may not be immediately apparent but could be part of a woman's health situation, and certainly might need some advice about how to get into a safe situation and stay in a safe situation. So all that is part of what's being covered in the new policies.
Great. Now, I know with so many women who are struggling to afford health insurance, we received a lot of questions about what are the options if I don't have coverage. Raquel shared the following question. She said, I work, but I have no insurance through my job, and I can't afford it. How would this affect me?
Well, right now for Raquel, if she has a serious pre-existing health condition and she has been denied coverage because of her health issues, which happens to women all the time in the market, there are now pre-existing pools in every state. So she may have some help available to get coverage. If she is just in a job where there is no employer coverage and the coverage is just too expensive for her to buy on her own, short term there aren't a lot of good options, but starting in January 2014, Raquel will have a number of options. She may qualify for Medicaid, and that program will open up and be available. And in every state there will be a state-operated exchange. And for people who are working but don't make enough money to buy their coverage 100% on their own, there will be some assistance, some tax credits, which amount to up to $4,000 per family to actually come into the insurance market. So insurance will be available without pre-existing conditions, and great news for women, it will be illegal starting in 2014 to charge women more than men. Right now, companies can totally legally charge a woman 50% more for a policy than her male colleague.
Just because she's a woman.
Just because she's a woman. As we like to say, 2014 begins a day where being a woman will no longer be a pre-existing condition. A brand new day.
Wow. Great. I think we have time for one more question. I know that a lot of people were interested in eye care and dental care and wanted to know when services like those would be available to them.
Well, again, starting in 2014, in the new insurance markets, which will be available, one of the things that will happen is as part of a policy, essential health benefits will be defined, what has to be in every policy. And then people will have an option to pay additional money and add services or look at a more robust policy or a less robust policy. But all policies will have some essential health benefits. So starting in 2014, we will be putting out guidance to states about what that essential health benefit package has to include. There's some areas spelled out in the law. We're looking closely at, what the popular employer plans in every state offer, what the state employee plans, what the most popular federal employee plans, and using that as the guidance for what should be in insurance policies. If you work for a big employer now, you're likely to have a set of benefits that looks very similar regardless of which employer you work for. It could be the state, it could be the federal government, it could be a private employer. So that will begin to define what's in an essential benefit package. So things like dental service and eye care and, a more robust package that makes sure if you need to go to the hospital that your hospital stay is paid for. Those kinds of things will start in the new market in 2014.
Great. So stay tuned for more in
bet.
2014.
You bet.
Well, unfortunately, that's all the time we have for today. Secretary Sebelius, thank you so much for helping us answer the questions. And to all of you who joined us, if we didn't get to your question today, you can find a list of all the services available to you at HealthCare.gov/prevention. And for more answers to your questions, just go to WebMD.com and search healthcare reform. Thank you so much for joining us.